Very good morning to all. Today we are discussing on the topic Biosmart Dentistry. Now, Biosmart Dentistry is a recent advancement in the medical field. Many researches are going on in this topic, and this promises to change the future of dentistry. Now, here are the contents coming from the introduction, classification of smart materials. Among the classification, we will be discussing about the conservative dentistry materials as well as the endodontic materials. So first of all, when we discuss biosmart dentistry, first thing that comes to mind is why are they called biosmart? What is the smartness all about? The first thing is that a material is said to be smart if it possesses great capacity to sense and respond to any environmental changes. Hence, these materials are also known as responsive materials. These smart materials are defined as design materials that have one or more properties that can be significantly changed in a controlled fashion by external stimuli. And what these external stimuli can be? These can be stress, temperature, moisture, pH, electromagnetic field, and many more, and reacts to it in a controlled and reversible fashion. And the special property of these biosmart materials is that it can return to its original state after the removal of the stimulus. That is not present in the materials that we are using today. Moving on, moving on to the classification. First classification is passive smart materials and another one is active smart materials. Now, what do we understand by passive smart materials? Passive smart materials are those materials that continuously release ions with or without the necessity to prevent the tooth material. They are continuously releasing the ions and whatever important property is there in them, they are releasing and providing prevention of dental caries. And most common of the example is GIC. Others are compomers, RMGICs, and many more that we are using already in a day-to-day basis. Then there is active smart materials. Why are they called active smart materials? Because they can react favorably when there is a hazardous variation in the environment surrounding the restoration. These are different from the passive smart materials we have been using from long before. Restorative dentistry is having CPP ACP Complex, smart composites, Ariston PHC, self-healing composites, smart ceramics, smart GICs, smart prep bars, and diamond smart wedges. In the endodontics, there is smart seal obturation system and night eye rotary instruments. So we will discuss in the next slides why they are called smart. First one is the ACP CPP complex. Now, this was introduced by Mayers and Innes, and it showed that the solubility of this ACP enables it to release supersaturating levels of calcium and phosphate ions. These are in proportion that is favorable for hydroxyapatite formation. Now, this is a very enhanced property of this ACP CPP complex that prevents the dental caries occurrence, but it has one disadvantage. The disadvantage is that the amorphous calcium phosphate is unstable in nature. So, in the environment, if we want it to get sustained, we need to add some CPP to it. What is this CPP? This CPP is a milk derivative. It is a milk protein derived which combines with the ACP and is used for the remineralization of the incipient caries. Now, this ACP CPP complex is releasing calcium and phosphate ions, and how it works we will see in the next slide in the diagrammatic representation. Here we can see in the two images the most famous brands that are present for the ACP CPP complex, the Recaldent and the Mousse Plus. Smart composites are similar to the ACP CPP complex. These are the same ones. They have the unique biologically active property, and it contains ACP as a filler that is encapsulated in a polymer binder, which may stimulate the repair of tooth structure because it releases significant amount of calcium and phosphate ions in a sustained manner. Now please focus on this slide explaining the mechanism of action. Here we can appreciate in this diagrammatic representation that there is an acid attack. So the bacteria is attacking the tooth, and there is lowering of the pH. The pH is getting lower than the 5.8. Then what is happening? Two types of ions are getting released, the calcium ions and the phosphate ions. What are the calcium and phosphate ions doing? Calcium ions have remineralization action and phosphate ions have buffering action. So the buffering action causes neutralizing of the pH, and the pH gets again approximately 7, and remineralization action is occurring. In this action we can see that whatever the lost had occurred because of the acid attack, the tooth structure is again getting remineralized. Here is another example of the smart materials. This is a glass ionomer cement, but it is an active smart material. It is a nano-filled glass restorative material, and its monomer matrix consists of a mixture of dimethyl methacrylate and inorganic fillers that include alkaline calcium silicate glass, barium aluminum fluorosilicate glass, ytterbium trifluoride, and highly dispersed silicon dioxide. These are called as intelligent smart materials because they release not two but three different types of ions. Along with the calcium and phosphates, they release fluorides. They release fluorides, calcium ions, and hydroxyapatite crystals forming hydroxyl ions. Here we have self-healing composites. Now, why they are called self-healing composites? Because they have self-sealing property. They prevent the microleakage. How they do so, we will see in the diagrammatic representation in the next slides. So, these are synthesized by dicyclopentadiene filled microcapsules within a urea filled crystal, and they have Grubbs catalyst among them. Can you appreciate this diagrammatic representation? Here you can see that there is a crack that is occurring. So in the restorative material, there are so many Grubbs catalysts that are dispersed in the restorative material, and there are microcapsules that are filled with DCPD complex present there. So what happens when the crack is initiated? It gets in contact with the microcapsules. The microcapsules rupture, and after the rupture, the DCPD complex is released and it comes in contact with the Grubbs catalyst. So what happens? There is a polymerization reaction that occurs here, and because of this polymerization reaction, there is a polymerized healing agent that forms, and because of that, what happens? The crack is self-repaired or self-sealed. So there is very less chance of micro leakage. That is why it is called as self-sealing composite, self-healing composite. Moving on to the next slide, it is about smart ceramics. Now, we know all the ceramics, but what is the smartness in the ceramics? Here, these ceramics that are used here are biocompatible, have excellent strength, toughness, reliable, and are made up of ultra thin monolithic zirconium dioxide and cerium gadolinium oxide. Now, because of the zirconium dioxide content here, they are very strong and they provide excellent aesthetics. And because of the excellent aesthetics, they can be used in anteriors also, and because of the high strength impact, they can be used in the posterior teeth also. They are even used for the crown and bridges. They are very strong and they are metal free.